Within the broad category of abdominal wall defects, you have two main diagnoses. You have gastroschisis and omphalocele. Now, simply put, gastroschisis is just an opening in the abdominal wall where the contents of the abdomen are outside of the abdominal cavity. What we do for those babies with gastroschisis is we can either try to close up the defect primarily immediately after birth, or if the child does not have enough muscular structure to close up the abdomen immediately after birth, we put a temporary, we call it a silo, a temporary housing over the intestines, and then we wait a few days for the swelling to go down, and then we bring those babies back to the operating room to close up the defect. Omphalocele is an opening in the abdominal wall, but now the contents are covered by a thick membrane, and so they're not freely floating in the abdominal cavity. Now, the treatment for omphalocele is different than that from gastroschisis. Most omphaloceles we can get closed primarily if they're up to about 5 centimeters in size. If they're much over 5 centimeters in size, we don't have enough muscle space to get everything closed primarily, and in that case, we have to do either a gradual repair of the omphalocele, or sometimes we just wait for the skin to grow over it and take care of the baby in the NICU for several weeks or even months, and then come back when the baby's 1 or 2 years old to do a final surgery. Abdominal wall defects, they're rare. They happen in 1 to 3,000, 1 to 5,000 pregnancies, somewhere in that range. And so, since they are so rare, you want to be at a center that has a lot of volume, even for a rare defect. And that's what we have at the Midwest Fetal Care Center. Even though abdominal wall defects is a rare diagnosis, we see somewhere around 30 a year, which makes us one of the busiest programs in the country for treating these types of defects. The outlook for babies with gastroschisis is excellent. The vast majority of the babies survive to discharge, and the great thing about gastroschisis is that's typically the only abnormality that these children have. So once you get the gastroschisis closed and you get the babies healed up from surgery and you get them discharged, they grow and develop normally, and they generally do not have any long-term difficulties or associated problems. For omphalocele, the long-term outcome is generally quite good. However, there's a subset of patients with omphalocele that might have other abnormalities. Up to a third of the babies with omphalocele can have other abnormalities, and that's something that we test very vigorously for. Some of these babies can have chromosomal abnormalities, some of them can have other anatomic abnormalities, and so for our babies with omphalocele, we're very aggressive about testing for other associated abnormalities that might need to be treated. The benefit of having a fetal care center managing these pregnancies prenatally is the care is standardized. And so we can follow the babies closely with routine serial ultrasounds. We can tell if the baby's developing a bowel blockage, or we can tell if there's any other associated abnormalities that might need to be taken care of immediately after the babies are born. The one thing we do with all of our babies with abdominal wall defects is we have a clinical care algorithm. So we're treating them all the same from the moment we diagnose them at 20 weeks until they're discharged from the NICU. At the Midwest Fetal Care Center, you're really going to get an entire team approach to the pregnancy, starting at the 20-week or the 16-week prenatal diagnosis. You're going to have access to world-class perinatologists, pediatric surgeons, pediatric cardiac surgeons, neonatologists. Depending on any other associated difficulty your child may have, you're going to have immediate access to world-class information and talent. And plus you're going to have the assurance that your child is going to be cared for at a high-volume institution with documented excellent outcomes.